Sometimes I wonder if we actually have GPs in this country anymore. I certainly don't think that I do. There's a GP practice that I attend every so often when I have to, and I have no idea who I'm going to see, and their only knowledge of me is what they flip up on the computer screen as I walk in the room. And I probably know more about what's going on than they do, which is disappointing because one wants reassurance when one goes to see the GP. I don't think I don't think it's available really, and it's against that background. The imminent strike by general practitioners in England, it's a significant event poised to impact the severely damaged NHS profoundly. And family doctors across England are currently voting on whether to undertake industrial action, potentially starting on August the 1st. This would be the first such action in 60 years, following a precedent in 1964 under Harold Wilson, when GPs handed in undated letters of resignation to the government. And the proposed action is primarily a response to a dispute over the new GP contract, which many in the profession feel fails to keep pace with inflation and doesn't adequately support the financial viability of surgeries. So the new contract offers a 1.9% funding increase from 2024 to 25, a figure the British Medical Association has argued is insufficient. In a referendum carried out by the BMA, a staggering 99% of the 19,000 GPs who participated rejected the proposed contract. Dr. Kate Bramall-Stanner, the chairwoman of the BMA's England GP committee, has been vocal about the inadequacies of the contract and the broader systemic issues facing GPs. She says, if it's done effectively, if it's done collectively and it's done well, it will bring the NHS to a standstill very quickly. But not for patients. For all the NHS admin, the policymakers who have put in place these decisions that aren't helping patients. The action, if approved, could see GPs limiting the number of patients they see each day to about 25, which is a third fewer than current levels. And this reduction is designed to be easy, sustainable and effective, according to Dr. Bramall-Stanner. She emphasised that the action aims to disrupt the administrative aspects of the NHS rather than the patient care directly, although it's anticipated that the ripple effects could be substantial. Matthew Taylor, Chief Executive of the NHS Confederation, warned that such a cap could have a catastrophic effect on the entire healthcare system, with general practice already supporting more patients than before the COVID-19 pandemic. Any reduction in GP activity is likely to increase pressure on other services, including A&E units, the 111 telephone advice service and mental health care. The strike is also situated within a broader context of public sector pay disputes. The Chancellor, Rachel Reeves, is expected to announce an above-inflation pay rise for millions of public sector workers, with the NHS and teaching pay bodies recommending a rise of 5.5. If accepted, this could cost up to £10 billion. However, the BMA has made it clear that the current proposals do not adequately address the financial struggles faced by GPs and their practices. Notice the concern is not only about the GPs, but about the practices as well. And part of my concern with the NHS is the overwhelming and ineffective bureaucracy that dominates it. I would have no hesitation in giving GPs extra money. I would have no hesitation giving junior doctors extra money or nurses extra money, but I'd have great hesitation in giving any extra money to the NHS, which would then go to the bureaucrats that control it and make sure or ensure that the system doesn't work properly and that patients have no certainty that what's going to happen to them is what is planned. And even when asking for paperwork afterwards, you don't get what you've seen before. You get something entirely different. The system is controlled by twits. Now, presumably your GP has some knowledge of what's going on, and therefore should take some responsibility. But who is your GP? Do you know? And that, in the end, is part of the problem, that there is no sense of personal responsibility in the system. It's been erased. And I would suggest that one of the ways to get back a sense of confidence in the NHS is to put the person back in the middle. Move the bureaucracy back to where it should be, which is to support the people, rather than dictate to the people, rather than control the people. Bureaucracy should be there as a tool to support. The NHS, which is already under immense strain, faces a potential crisis with this looming industrial action, and primary care leaders have indicated that up to 3 million GP appointments could disappear each month if GPs proceed with limiting patient numbers. It's bad enough getting an appointment to see a GP anyway. This will make it worse. This reduction could significantly exacerbate existing pressures on the healthcare system, which is still grappling with the after effects of the COVID-19 pandemic and the battering impact of years and years of funding the wrong people, of funding the bureaucrats rather than the people who do the work. I think it's very simple, and I'm not attacking bureaucracy or bureaucrats or civil servants as such. Many of them do a very fine and very noble and very worthwhile job. I'm simply concerned that somebody who is managing paperwork is paid less than somebody who is managing a scalpel and managing our health. Somebody who is doing the work should by principle be paid more than somebody who is pushing a pen round a piece of paper. And by the way, as I'm saying this, I am a person who pushes a pen around a piece of paper. I do not think that I should be paid more than somebody who has my life in their hands. The paper pushers, the pencil pushers, should not be paid more than the doctors, the surgeons, the nurses, the GPs.